Arkansas Surgeon General Dr. Greg Bledsoe has recently kept Twitter ablaze with his takes on why people are so hesitant to receive the vaccine. He's also sharing what he's seeing firsthand as an ER doctor. Our Jay Burr spoke with Dr. Bledsoe today, and Jay, he's been very vocal on social media about these two subjects over the last couple days.
Yes, very vocal indeed. In fact, he is also an ER doctor at Mercy Hospital, so he's got to kind of get that boots on the ground perspective for people, and that is one of the things that he tried to share. He also kind of shared what he thinks is wrong with the messaging of the vaccine here in the state. And again, those recent case numbers, as you just mentioned, are on the rise, and it has him and many in the medical community concerned. Arkansas Surgeon General Dr. Greg Bledsoe recently put out a Twitter thread on what he has seen in his ER and what colleagues have told him they are experiencing also. The numbers are climbing as more cases lead to more hospitalizations, and Dr. Bledsoe says it's a mounting concern here in the state.
You're looking at the Delta variant, and you're looking at the numbers of positive cases. It's very worrisome for those of us who are in emergency medicine.
He said the number of patients coming in with ages in the 20s to the 40s is also much higher recently.
And what we're finding with the Delta variant is that it's attacking younger people more severely, and so the age of the inpatients is going down, and we're very concerned about that.
He points out the data is very revealing about who is mainly not taking the vaccine.
I mean, when you look around at our country and at our state, the people who aren't getting vaccinated are conservative red state voters. And so, no one's arguing that.
He also tweeted that many experts and those in academia have tainted the conversations about the vaccine to those conservative red state voters because of their history of having much more liberal stance on issues such as gun rights and abortion. Dr. Bledsoe believes this conveys an attitude of moral superiority when speaking on the vaccine, whether it's intentional or not.
They see them as adversaries. That colors these conversations going forward. And I think there's been too much of that very inflammatory rhetoric. And so now we're in a situation where we truly have a public health crisis, and a lot of the red state conservative voters have tuned these people out.
He wants and advocates for people to get the vaccine in order to stop COVID from spreading, but he doesn't condemn those who haven't. He hopes leaders in Arkansas will do more of the same.
We need to make sure that we're not communicating to people that they're bad people or they're morally inferior or they're ignorant or they're anti-science or anti-health care if they've chosen to be cautious on this issue.
Now, Dr. Bledsoe is also running for lieutenant governor as a Republican. He also does say that many conservatives in the state have run up on some of these very similar issues when they do advocate for the vaccine, but he does say it is all in the messaging, and he says really a lot of folks in the medical community do want what's best regardless of any political affiliation. Live from the state capitol, Jay Burr, KARK 4 News.